We are seeing epidemic levels of stress in children and teenagers with increasing rates of clinical depression, anxiety, and other coping problems. Fear, uncertainty, and lack of control, factors that power stress, are ramped up in times of rapid, unpredictable change like we're experiencing now during the COVID-19 pandemic. And puberty is a time of massive change: hormonal, physical, sexual, social, cognitive, and neurological. We know that 1 in 8 young people will experience a mental health problem. And puberty brings a level of volatility in attitudes, behaviour, responsibility, and moods that can look and feel like mental illness. Most parents experience at least some moments of concern for their children's mental health during the puberty ages. But should you? Or is your child experiencing a normal transition into adulthood? It isn't always easy to distinguish between the typical moodiness of puberty and mental health conditions that require professional attention. If you're wondering about your child's behaviours, here are 5 questions to ask yourself. These could provide a good starting point for understanding how serious the problems might be and whether you should seek professional help. Does your child have at least one good friend? Although most young teens prefer popularity, one close friend is enough to get through puberty with resilience. If your child has no friends, that's often a sign of isolation and a strong reason to consider professional help. Does your child have at least one adult they can talk to? This might be a parent, another relative, a teacher, or someone else, someone who can provide wisdom and support. Does your child have at least one activity that engages them? One productive area of interest can sustain a young person through tough times. It might be a sport, the arts, a school subject, gardening, anything that involves thinking, learning, and developing competence. Is your child ever happy? It's normal for preteens and early teens to express more irritability, annoyance, and anger, especially with their parents. But if your child never seems happy or contented, then that is cause for concern. Is your child engaging in self-harm? This includes alcohol, drugs, and other toxic substances, cutting, sexual promiscuity, and self-sabotage like skipping school. It's normal for a child to be curious about these things, but it's time to seek help if you think your child's well-being is threatened by dependence on any of these activities. If your child does have an effective network of social support, including at least one friend and one adult they can talk to, is happily engaged in one or more productive activities, and is not engaging in self-harming activities, you're likely dealing with normal puberty. However, that doesn't mean your child doesn't need your help. Seek out professional advice to discuss things further if you remain concerned. You might also find this video by me helpful. Thanks for watching. My name is Dr. Saab Johal. Please be sure to subscribe for more videos. Take care and go well.